Okay, we're going to continue on in your circulation chapter. This is video number 2. I'm starting up on page 408 in your anatomy book, which is where we left off from video number 1. Okay, so routes of circulation. We touched on this in the heart chapter. We're going to reinforce this here in the circulation chapter. So we talked about in the heart chapter about how the blood goes through one side of the heart when it doesn't have oxygen. It goes over to the lungs to get the oxygen, comes back and goes through the other side of the heart, and then goes out to the body. So we have systemic and pulmonary circulation. So the pulmonary circulation is literally the part where it goes from the heart to the lungs and back to the heart again. Okay. The systemic is when it goes from the heart out to the body, or all the body systems, and then back to the heart again. So starting our story at the left ventricle, which is the side that has the oxygen, ventricle is where it's leaving, all the blood goes through the valve and into the aorta. Every drop of blood goes, this is the aorta here with these three little, it looks like a rooster to me, 3 little outlets. They're actually arteries that go out, but they don't show you the whole artery, they cut them off. So this is the aorta. Every drop of blood leaving your heart goes into the aorta. So if the patient has a problem with their aorta, that's a big deal. An aortic aneurysm that we just talked about, an aortic aneurysm, if that blows, the patient's usually dead before they hit the ground. That's a pretty serious one. So then it goes out to the body. This is a very similar picture to what we covered in the heart chapter. Remember, blue is no oxygen, red has oxygen. These are all the arteries and all the veins in the body. We will cover this more when we get into coding for the arteries and veins, because there are times that the doctor will reference specific arteries and veins, and we have to code it specifically. So that's kind of a big thing with coding. Now, if you don't ever go work for those kinds of doctors, guess what? You don't have to learn a lot of this. So it's going to be specialty specific. All right, so we talked about the pulmonary circulation and the systemic circulation. The next one we want to talk about is the hepatic portal circulation. Hepatic is med term for liver. So we're talking about liver circulation here. Okay. So the purpose of the liver is to clean our blood. It cleans out toxins and any other irregularities in our blood. So where does our blood get most of those toxins is from what we eat. We take pills, even just Tylenol and even prescription, but the body calls that a toxin. We drink alcohol. We eat banana splits for dinner. So we have lots of sugar. Okay. So we have all kinds of garbage that we put into our body that we don't want circulating in our blood. So what we do is we take the blood that go through the arteries from our digestive system, the spleen, the stomach, the pancreas, the gallbladder, and the intestines. And instead of sending that blood back to the heart to go out again, we're going to send that blood to the liver instead. So the arteries and veins and the capillaries in our intestines have already cleaned the blood once. We're going to send it to the liver to clean it a second time, because the liver can get rid of things that normal capillaries can't. And so these are our digestive organs. We eat junk, we drink junk, and so we need our liver to do its job and clean it for a second time. So we divert this blood to the liver to be cleaned a second time, so that hopefully when it leaves the liver, it's cleaner than when it went in. And it is, because that's how the system works. Okay? So you'll need to know why it does this, how it does this, and what digestive organs it does this for. Okay. The last type of circulation I want to talk about is a fetal circulation. Up to this point, all of us work the same way. We all have a systemic circulation in the pulmonary, and we all have the hepatic circulation. And that's normal. But how does that change when we add a fetus to a pregnant mother? Now we have an extra thing in the body that needs a blood circulation that wasn't there yesterday, that won't be there 9 months from now. So there has to be something extra that happens in the mother, and then what's happening on the fetal side. So the thing that happens in the mother is we have the growth of this placenta. It grows on the uterus, which is here. This is the placenta. And mom has arteries and veins that grow to attach to the placenta to give that placenta a blood supply. That placenta on the other side grows out a connector to create the umbilical cord supply to the fetus that is growing. There are umbilical arteries and umbilical veins because we want blood to go into the fetus and back out of the fetus and back to the mother. So it's a two-way street. Okay? So those are the things growing on the mother side. How does the growing fetus differ from a born human baby? I don't want to say live because it's still alive. How does it differ from one that's already born? So how is it different inside than it is outside? So to answer that, I'm going to draw this heart again. Remember, we have these dividers like this for our chambers. Let's remember that flow of the drop of blood, how the blood goes from the heart to the lungs, back to the heart and out to the body. It's not the same on a growing fetus. Okay. The baby, the growing fetus, has, I want to say 4, I'm only seeing 3, maybe it is only 3. 3 structures that do not exist once they're born. They only exist in the belly. The first one is called the ductus venosus. The ductus venosus bypasses the immature liver of the fetus. So that hepatic portal circulation that happens in us doesn't need to happen in a fetus because remember, they're not eating garbage like us adults do. So they don't need that second cleaning in the liver like they will once they're born. My cat's jumping up. So that ductus venosus bypasses the immature liver and takes the blood and drops it back into the inferior vena cava, which then it can get back circulating into the heart like we want it to. The next structure is called a foramen ovale. This shunts the blood from the right atrium to the left atrium. Okay? What this does is the blood comes in, goes over, and goes out. It doesn't work that way in us. The whole point of the blood, let's go to blue, needing to go over to the lung is to pick up oxygen. Well, that's not going to happen in a fetus. The fetus isn't breathing. So there's no need for that blood to go over to a lung. That's why this foramen ovale exists, so that the blood goes straight into the baby's heart and out to the baby's body because the blood has oxygen from mom. So that blood already has oxygen in it. So for a baby, there is a hole. Whoops, didn't mean to do that. There is a hole in that wall of the heart. It's called a septum. The wall is a septum. There's a hole in it. That's not supposed to be there once they're born. You and I don't have a hole in our heart. That would be a bad thing. The third structure is called the ductus arteriosus, and it connects the pulmonary artery straight to the aorta. So what this one does, so the blood goes like this, right? What this one does is if any blood happens to go this way, we don't want it to, but let's say it happens to make it through, it misses the detour, that blood is going to go straight back up to here. It connects the pulmonary artery. Oh, sorry. It doesn't go in there. It goes from here over to here and joins in the aorta. So it kind of makes sure that everybody gets to where they're supposed to go. Okay, so now we have this. So now we have this heart. With this hole here for the blood to get through. It's not supposed to be there. What happens? You got these three structures that aren't there in us once we're born. So what happens to them? What happens is a really cool thing. As soon as that baby is born, it is now needs to breathe on their own. That first breath that baby takes changes the entire structure because it increases the pressure on the inside of the baby. And all of those structures that were there as a fetus go away. That change of pressure on the inside slams that door shut. That closes up. The foramen ovale and the ductus arteriosus close. That first breath baby takes is really important. It does a lot of things to their respiratory system. And their body is now introduced with their first breath of oxygen. And all of those things now happen on the inside of that baby as it's born that turns them from a baby on the inside to now they're on a baby on the outside. All of those structures go away. Then, of course, mom is going to deliver that placenta as well as the baby. And all of those other structures that mom grew is now gone as well. Pretty miraculous system. Okay, let's talk about blood pressure. Blood pressure is the push of blood as it goes through the cardiovascular system. So as that blood is coming through the arteries and the veins, what amount of pressure is present in there? We know what's normal, and then are you above normal, low? What is it? Because there's only so much pressure those arteries and veins can take. So if your blood pressure goes too high, it can be a serious problem. It can handle a little high. Blood volume affects your blood pressure. How much blood do you have? So if I just gave blood and they took a pint or two out of my arm, probably just one, I have lowered blood volume, meaning my blood pressure will go down because I have less blood inside me. Of course, my body will make more and my blood pressure will go back up in a couple days. That's okay. I can survive that. Strength of heart contractions will also affect your blood pressure. So if you have a weak heart and it's beating weak, you're going to have a lower blood pressure than a healthy, strong heart that's beating normal. Then your heart rate. How frequent is your heart beating? Normal from a resting. Actually, normal is between 70 and 100 times a minute. If you're resting, it's at the lower end of that. If you're exercising, it's at the higher end of that. And that's normal. And so how many beats per minute will depend. when my father was at the end of his life, his heart had slowed down, and you could take his heart rate or his pulse, and it would almost seem like it rested in between beats for way too long. It's because his heart was very weak at the end, and it was not pumping at a regular speed like it should be when you're healthy. Okay. The next one is the blood viscosity. I already explained this term. Viscosity means thickness. So how thick or how watery is your blood? I had given you, like we were talking about the polycythemia, and I talked about, imagine your blood being ketchup. Okay, that's your thickness. That's the viscosity. But it could also be very thin. Let's say you drink a gallon of water. Your blood's going to be very thin and watery until your body makes urine to counter what you just drank. All right. Pulse. Okay. So the pulse we talked about a minute ago, as far as 70 to 100 is kind of the normal range. But let's talk about, where do we feel pulse? There are several places in the body that you can feel pulse. The most common one that the doctor's office is going to do is called a radial pulse. It's, if you look at your hand, you've got your center veins and arteries here go slightly towards the thumb side, and that's called the radial pulse because this is the radius bone. So the radial pulse is like right here. You may know how to do that, or you have seen medical assistants where you've been a patient has done that on you. Okay, so that's one of the major pulse points. However, there are others. How would you do that if the patient didn't have arms? Okay. Or they're profusely bleeding from their arms from a trauma. Guess you can't use those body parts. What else you got? The carotid artery in the neck. There is a temporal here. There is a facial here. The brachial, which is the one they put the stethoscope over when they take your blood pressure. There's the femoral, which is like right here, up in the groin. The popliteal is on the back side of the knee. And then you have the tibial down here in the ankle. So there's several places you can take it. Another reason why you want to know multiple places is that if you feel that a patient might have a blood clot in their leg, if you take their pulse here and you take their pulse here, come on, draw. They should be darn close to the same number. If your one in your foot is way down, that means blood isn't getting to the foot, and it can be a sign of a blood clot. So they will sometimes take them in more than one place if they feel it. So here's what I was just talking about, all the ones I just pointed out. Hypertension is high blood pressure. Not a lot. Okay, the last section of this chapter is shock. Circulatory shock just means that the circulatory system is not getting oxygen out to where it goes. Okay, that's a generic term. There are 5 kinds of circulatory shock depending on why the blood can't get to where it's going. Med term, genic, means origin or originating. Okay, so the first word is cardiogenic shock, which means originating in the heart. That means the heart is the problem. It could be a heart attack, a heart infection. So that means the heart is not pumping the blood out. Hypovolemic. Hypo means low, so low volume. Hypovolemic shock means that you are losing blood. This patient could be hemorrhaging, massive trauma. That means the heart is working just fine, but the blood is exiting the body like it's not supposed to. You could be hemorrhaging. It can also be from chronic diarrhea, lots of vomiting, dehydration, burns, other reasons why you might be losing blood volume. Okay, the next one, neurogenic, which means originating in the nerves. So your heart's fine, your blood's fine, it's a brain problem, which means that there's an imbalance of your smooth muscles from the autonomic system. It could be from a spinal cord injury, medications that depress the nervous system, emotional stress. So that's what can cause these. The next one is called anaphylactic shock. This is an allergic reaction called anaphylaxis. So if the patient has a severe peanut allergy and they had peanuts of some sort, this can cause the blood vessels to dilate and cause the blood to not circulate properly. The last one is septic shock, also known as septicemia, which is blood poisoning. Could be toxic shock syndrome or other infections in the blood. So now the heart's fine, the brain's fine, but it's an infection in the blood that's the problem. Okay. That's your chapter. So let's do your takeaways. This may seem like a very short takeaway slideshow. There's only 4 slides plus this one. Don't think that doesn't mean there's a lot in this chapter. There is still a lot in this chapter. Arteries and arterioles carry blood away from the heart. Know that the exchange vessel is that capillary, and then the venules and veins. Know the tunica intima, media, and externa, and what the difference is between arteries and veins in those layers. We talked about several diseases. Know those? We talked about the systemic and pulmonary circulation, which was a review from the heart chapter. And now we added on the hepatic portal circulation, know which organs are involved and why this even happens. And then we talked about the fetal circulation. I should have thrown placenta on here as well. We talked about the ductus arteriosus, the ductus venosus, and the foramen ovale. And the 5 kinds of shock we just covered. Know all those. It may seem like a very short slideshow, but there's a lot of information on those slides.